I think that as this pandemic has gone on, we've gained a better and better understanding about the pathogenesis of the infection and what it does. So when COVID came to the United States in March and April, I think people initially thought of it more of a respiratory tract infection, but it was recognized early on that people were seeing blood clots. And what's been well recognized now is that the respiratory tract is how the virus gets in. It infects other parts of the body, and in particular, it affects what we call our endothelial cells. These are the blood vessel cells. It infects our blood vessel cells in a way that in some people, it triggers blood clotting. So we call this the coagulopathy of COVID that causes thrombosis. So now, in the last month or two, when patients come in with acute COVID-19 infection, we assess their clotting. We have blood tests that indicate if they're at risk for clotting, and we put them on blood thinner. So I think the autopsy series was primarily from patients who came in early in the pandemic, when I think the recognition about the clotting problem was less common, and the protocols for blood thinners were not in place in a lot of hospitals. I think every hospital now that treats COVID-19 patients have protocols for assessing the clotting status and then mitigating this tendency to clot if the blood tests indicate that the patients are at risk. When patients have an acute illness, their risk for clotting may last for a couple weeks or more. And when we identify those patients, we actually send them home on blood thinners. But once you've completely recovered, you're not sick anymore, and you're out of the acute illness, the risk for blood clotting goes down every day that you're out from the acute illness. Yeah, I think we have a good idea, and I've heard really superb presentations by some of our hematologists here at University Hospital. And basically, the endothelial cell is a cell that lines blood vessels, and the virus gets in that cell and disrupts its normal function. And those cells are really critical in this balance we have between bleeding and clotting. And the way the virus disrupts the cell tends to trigger clotting. So it gets in the cell, infects the cell, disrupts its normal systems, in such a way that it puts the balance on the clotting side versus the bleeding side. Well, the blood clotting in COVID-19 disease is a bit different. I mean, what you see in patients who are, on an 18-hour car ride or laid up from a knee surgery is that they're in bed, they're not moving, their blood is pooling, they can get big blood clots. And then there's times when those big blood clots in their legs can break off, go to the lungs, and can cause a very serious and sometimes fatal illness. The blood clotting in COVID-19 tends to be more diffuse and affecting more organs. There have been a few patients who've had the big blood clots, but in general, it's different. And some of the patients who end up on ventilators, it isn't because they've had one big blood clot that was in their leg and broke off and went to their lung. Is that their lungs are filled with little blood clots, tiny blood clots. And again, as this has been recognized over the last month or two, there's now protocols in place to measure blood tests that indicate ongoing clotting or risk of clotting, and then put patients on medicines to mitigate that. And if the blood test at the time of discharge still show this clotting tendency, we send patients home on a blood thinner for a month. Currently at University Hospital, any patient who has a COVID test ordered by a physician can get a test. So we're in good shape. I think what's happened nationally is there's been a demand for testing nationally, and there's just a fixed number of reagents. And nationally and locally, in most parts of the country, we kind of started to see a downtrend in cases before Memorial Day. We've had this increase in Ohio and Cuyahoga County, nothing like Arizona, Florida, Texas, but because these increases are affecting so many states at once and the demand across the country has gone up, I think there's some shortages of reagents. But currently at University Hospital, we've not run into limitations where if a UH doctor orders a test, the patient can get tested. I think that we all got a little complacent, maybe by the end of May, and the messaging from our government leaders was a little inconsistent about. I'm talking nationally, a little inconsistent about what was safe to do, what was not safe to do. And I think what happened is people let their guard down. And the key to spreading the virus is being in like an indoors enclosed space with people you don't normally associate with, not your core household group, in an indoor space without masks. And I think as we got pandemic fatigue and we got complacent, and the messages was that we're opening up, people went to bars, restaurants, clubs, house parties, even things like church, unfortunately, an indoor event where people were singing. So I think we need to go back to not a shutdown, but we need to really understand that masking, particularly indoors, is critical. It's these indoor events where people are congregated together, where if one person is asymptomatically infected, they can spread it to 50 people. And that just escalates the spread. And we've seen this in Florida, Texas, Arizona, to a big extent, a disastrous extent, where they're running out of ICU beds. We're not in that critical stage in Ohio, but people need to go back and realize the pandemic is not over. I should not go to a indoor house party. I think people should not go to an indoor bar if they do wear a mask, and not that easy to spend time at a bar with a mask on. And I understand that everyone is tired of masks. We all are. But until we get this under control again, in stores, indoor spaces, malls, church, synagogues, mosques, people need to wear masks. And I tell people, don't blame the mask, blame the virus. The virus is telling us what to do. We let our guard down at the end of May, and the virus has told us that was a mistake, that we're seeing cases again, and we're seeing increased deaths, increased hospitalizations. So people need to take a breath. The pandemic is not over. It's getting bad again. The only way to stop the spread of this virus is to avoid situations where person-to-person spread is somewhat likely. Indoors, unmasked with other people, is how the virus gets spread. Outdoors is much less risky. I don't think there's any cases of what we call super spreading events outdoors. If you're in a crowded, bar or restaurant, it's possible that someone can infect a couple people. But these events where everyone at a party, everyone at a bar, everyone at a restaurant, everyone at church gets infected, these are almost all indoors. So I would emphasize masking indoors, some social distancing outdoors, masking outdoors if you have to be very close to people for a prolonged period of time. And this is what our governor's saying. The governor said, in these high incidence counties, which is more and more counties in Ohio, mask indoors no matter what. And then outdoors, don't mask unless you have to congregate, in a way that might be unsafe. Yeah, I think we need to see what happens. I mean, the economic pain of the shutdown was so hard on people that if people would just wear masks, and again, this is true across the country. What we've seen is, restless people in their 20s and 30s who feel like they're not going to get sick. They've gone to bars, clubs, house parties, and then they're spreading it to other people, and then they're coming to the hospital. This has to stop. And, I appreciate the economic pain of bar owners and restaurant owners, and I'm not a policymaker, but I would not go into a bar now, or I would not go into a crowded restaurant without a mask on. And it pains me to say that indoor church services where people are close together is another place where we see lots of spread. So people should realize that the virus is still here, it's still being spread, particularly indoors with strangers, with people you don't normally associate with day to day. You have to wear a mask, you have to do social distancing. If we can do that, we could avoid one of these painful shutdowns. And I don't envy Dr. DeWine. I don't envy Governor DeWine for making these decisions. it's been my hope all along that if people would just grasp the concepts of social distancing and masking, we could avoid a shutdown and get to the end of the pandemic without too many deaths. The pandemic is not going to end until we have a successful vaccine or successful treatments. And we know a vaccine won't be here until the end of the year at the earliest. And there's no successful treatment, highly effective treatment right on the horizon. We're getting better at treating the illness. I think there's less deaths. We're giving remdesivir, we're giving plasma, other therapies, but people are still dying. And if we don't get it under control, we'll see more deaths.